Thank you all for clicking onto the video and watching this video that is pretty much out of the ordinary, a little different. I had two YouTube channels, one for my medical stuff, because in case you don't know, I am a medical assistant in a hospital here in Chicago, and I am going to school to finish my RN license, well, to be an RN, I should say. But I also have my beauty channel, all about makeup reviews and fashion and all that girly jazz, all that stuff. But I don't want to have two channels, so I'm just going to combine everything onto this channel. So I hope you guys enjoy it and learn something new from me. Again, like I said, I'm not a doctor, I'm a medical assistant, and yeah, that's it. But today I wanted to talk about a really cool surgery that I got to see and be involved with. I work in the urology department here in a hospital, and it is so awesome. My background is internal medicine, which is just a little bit of everything that we see. But urology, in case you don't know, urology focuses on everything that has to do with the urinary tract. So your kidneys, the ureters, the bladder, the urethra. For women, you know, our vaginas. For men, penises, obviously. But my department specializes in men's health, so we're geared more towards things that affect men. The prostate and, well, mainly the prostate, because we don't have that, in case you didn't know. We don't have prostates. But yeah, that's one thing that we focus on is men's health. So we see a lot of men. I think for every 20 men we see 2 females. Kind of sucks, but that's why as women we have our gynecologists. We go to the gynecologist, men, urologists. Although women do see urologists. Just clarifying that, okay? Women do see urologists because, you know, we have issues with our urinary tract. We're so prone to UTIs. But I'm straying too much from my original topic. Sorry, I do that a lot. Sorry, guys. But anyway, yes, the main topic was the surgery that I got to see, which is the doctors often go to the ORs to do all their surgeries, but slowly we're bringing some surgeries into the clinical setting because they're quick outpatient procedures. The patient might just have to stay for 10-20 minutes for observation, and then they are free to go on their way. Well, the first surgery that I seen in the office, that was like an actual surgery they cut into the guy, was a vasectomy. Oh my god, oh my god, oh my god, that surgery was so, oh my god, it was intense because I didn't know what to expect. You know, the men are not put under. In case you don't know what a vasectomy is when they cut the men's, there's a tube in the scrotum, the vas deferens, well, not a tube, but it's called the vas deferens. They cut it, it's like literally they cut, it's to here, the ligament, and they cut here and here, and they remove this piece and they burn it off. In my office, at least, they burned it, and that's so guys cannot make babies. And we're sterilizing them for all intents and purposes. They're being sterilized. And they do it often in the OR, but they started doing it, like I said, outpatient, so the patients are coming into the clinic. Oh man, it was so, oh my gosh, I'm telling you guys, it was pretty awesome to see. And the patient's laying down on the table, and I bring them in, I check their vitals. You know, we do blood pressures, blood pressure, temperature, check their oxygen, check their pulse, you know, make sure they're okay for the surgery. I had to go over the consent forms, and then I have to prep them for the surgery. And what that entails, to make sure everything is clean down there, and the guy has to shave before he comes in. Because you don't want us to shave you, honey, because we don't have shaving cream. No, that's just water, and I'll be nice and I'll try to get it soapy for the guys. Others don't do that. They just wet it and start shaving. Ow. Ow, okay? No, I try to be nice to the guys. I won't do that. But for the most part, the men already come in already shaved. And when Okay, so they're shaved. We put the sterile field all over them. You know, we're sterile head to toe, just like in the OR. So it was really cool because the doctor really treats you like you're in the OR. He has his sterile field. He's gloved from head to toe. I had to put the gown on him, you know, tie the gown, which was really difficult. I couldn't figure out this freaking gown that we had, because it had like rope on the side and in the back, and I was like, oh my god, doctor. And he's looking at me like, calm down, it's okay. But I always started like rushing, like, oh my god, let me hurry up, and the doctor's like, breathe, just breathe, we're gonna be okay, you know, the patients are there, calm down. And I'm like, you're right, I gotta be calm because there's a guy on the table and he's watching everything that's going on. He's watching all of us. So calm, cool, and collected. Had to gather myself. And so we get started. We clean the guy's area, just the scrotum. And the doctor brings in the lidocaine and he starts injecting into the scrotum. You know what the scrotum is? It's where the guy's testicles are. Ladies, do not kick them there. Nobody should kick a guy there. That is so sensitive. And it happens sometimes. They deserve a kick in the balls. They do. But it's so sensitive down there. So they're cleaning the guy up and then injecting him with the lidocaine. And it's just lidocaine. Straight lidocaine. Vamos. 1, 2, 3. And then the doctor gets the scalpel and he starts cutting. Like, first he's poking them, like, can you feel this, can you feel that? The guy's like, no, I can't feel anything. Okay, we're good to go. He slices into it and I'm like, okay, I've never really seen like a surgery, so I was preparing myself because I'm like, oh my god, I don't want to be a sissy and pass out because there's going to be all this blood everywhere. And okay, who are they taking care of? The patient on the table or me, my dumb ass on the floor, you know? I was like, oh my god, please god, please don't let me pass out. But I didn't. I was like, oh my god, I was like all, not in his junk, but like, oh my god, this is so freaking cool. So we cut it, and then the doctor took the scalpel, he put like scissors to separate it, and he's separating everything. Sorry, this is gonna get a little gory, so if you don't like gory stuff, I suggest you just click out of the video. I won't be offended. So, and then he's looking for the vas deferens, and he hands me the scissors. He's like, hold on to this, and I was like, oh my god, oh my gosh. And then the guy's penis was like flying all over the place. He's like, just hold on to it. So he's, you know, well, this is not obviously the penis, but he's like, hold it up. You hold the penis, and then with the other hand, hold this part. I was like, oh, okay. So it's me and the nurse in there. The nurse she was mostly taking care of like the sterile field, making sure the doctor didn't contaminate it or like put non-sterile things onto the sterile field, which she was trying to do, but she caught him and she would like collect the stuff from him. So it was really interesting, like that whole part. I was like, oh my gosh, you really have to be like so protective of the sterile field. So scrub nurses, God bless you guys, because that wasn't easy to do. And it was a quick procedure. It was 20 minutes. But that sterile field, one wrong move and you contaminate the whole thing. And that sucks because everything's contaminated, so you have to be super careful. And the doctor kept getting the syringe and just put it down, and she's like, no, she was catching it, and she kept telling him like, doctor, stop doing that. But that was another whole argument we had with him afterwards, like, no, you know, we have to really be careful. Just because we're outpatient doesn't mean that we can just do whatever we want. You know, we have to follow protocol as if we are in the OR. So okay, that's going on. The guy's just sitting there like, okay, he's just sitting there chilling. So I like to talk to the patients, and I was like, how do you have kids now? And he's like, yeah, we have 2, but I don't want any more. We're done, that's it. He's a young guy, like 35 years old, but he was such a trooper. He didn't have any pain, and the surgery went fantastic. But now they just have to come back in 6 weeks, and in 6, 8, and 12 weeks. 6, 8, and 12. Yeah, they have to come back 3 times. They have to bring us semen sample because we have to make sure there's no swimmers in there. Make sure, you know, the doctor close it all off. But it was, I'm telling you guys, it was just interesting the way he finds the vas deferens. He cuts it and then he burns it, and he gets another piece, he burns that, and he separates it. You know, he takes that piece out, and you have 2 pieces of the tube here, and he's burning them off, and then he sutured them. So he's sutured. How do I sewed it together so they don't reconnect, because there is a possibility that the two ends can find each other, reconnect, and guy's gonna start making babies again. He's like, what the heck? I just had this surgery. Why am I still making babies? So the doctor sutured both ends of it to make sure that, you know, they don't reconnect. I thought that was so awesome. I don't know about you guys. You guys are probably like, this girl's a freak. Why does she like this stuff? But it's just what I like. It's interesting to see all these procedures, and it's just so cool. It's so fascinating. It is. I'm crazy, I know, but it's just really interesting to see, like, especially because we're in men's health. You know, as women, we think about ourselves and our bodies, the stuff that we go through. I never thought like what my brothers are going through, what my dad might go through one day. Hopefully never. When it comes like prostate cancer and all that. Oh my gosh, it is, men, I am more sympathetic to you, to your needs. I'm here for you dudes. Really. Need a urologist? Hit a sister up, because I know someone who could hook you up. In all seriousness, guys need to be checked out once a year. Just like women do. Hey, you need it, right? But I'm babbling. Sorry. I'm babbling. I babble. I do. But yeah, that's all I want to say about the surgery, the vasectomy that I've seen. There are other procedures that we do in the office, and I'll make other videos of them if you guys are interested in hearing me talk about those other procedures that we do in the office. If you're interested in the field of urology, if I can't answer, like I said, I'm not a doctor, I'm a medical assistant. If I can answer it, I will gladly ask one of my physicians, and I will make a video just for you. So let me know what you think of this video. I know I'm very chatty Cathy in this video, sorry. This is my first like really talking video, not like talking about a product or anything like that, so it's a little weird for me, and you can tell. But yeah, that's it. I'm gonna go now because I'm gonna go.